Sagittal T1. This is a female, 41 years of age. This is a contrast enhanced MRI scan of the brain. And we have, I don't know, it says nothing. I'm supposed to guess. So let's guess why this scan was performed, was done, was made, because there is no clinical history. Pituitary gland is a bit smaller than usual, but it's okay for 41. This is an axial FLAIR. There is some bright spots right there. There is a large spot right there and another large spot like that. Right there. Yep. Occipital lobe. Maybe. Yeah. Right there. Parietal. Inferior. Parietal lobe. And right there on the frontal parietal region on the left. It's right here. Yes, there is some kind of acute disease right there. Let's see if it's right on T2. It should be. Yes, it should be. And it has some kind of nodularity, some odd looking image right there. It's on the subcortical white matter, but the periphery of it has some effect on the cortex as well. And let's see if I can say the same about that other small lesion right there. No, this is quite homogeneous. Is there anything else? These are the two major sites. I have no clinical history, so I won't do a very complex guesswork because I will be wrong no matter how much I push myself. So this is a bit brighter than what it's supposed to be, and the inside of that other lesion is also a bit brighter than it's supposed to be. On right there, this isn't showing up in FLAIR. And this is the diffusion-weighted. Let's grab a ADC map. ADC map is here. Let's see if this is shown as a black spot on the ADC map. It's not. Yeah, it's a bit darker than normal white matter, so it is restricted diffusion, mild restricted diffusion, right there and right there. So this is starting to look like a secondary metastatic disease. I wish I had clinical history, but we don't have any. We're just going for guesswork here. So guess away. I'm going to do an MPR of the post-contrast volumetric T1 with contrast enhancement right there, so I can localize the lesion on this very thick FLAIR and see it enhance right there. So this is an enhancing lesion, and right there yet another enhancing lesion, intra-axial enhancing lesion right there, and there is marginal edema. So heterogeneous, it's bright on T2 and FLAIR, hypointense in T1, it enhances, and it has a signs of restricted diffusion and no clinical history, but I would go firstly with secondary disease at her age group, 41, could be anything, breast cancer, could be spinous epithelial cancer. It could be lung cancer also. Gastric and esophageal cancer could be. But I couldn't say because there isn't any clinical history whatsoever. So I'm just going to describe the lesions and be on my way because we won't go anywhere. I'm just going to measure this 0.8 and this is a 1.0. So let's grab a normal template for starters. Normal template and delete the diffusion-weighted sequence and the non-enhanced lesions sequence. And let's describe the lesions. So they are solid, intra-axial, they have peripheral edema, and they enhance. This is